Hi, podcasters. I'm Dr. Mary Larajani.
And I'm Dr. Rina Lau.
And welcome to the Skin the Surface podcast, where we are going to address various topics related to your skin.
Just for some background, we are two dermatologists and friends who train together and work together in the Philadelphia suburbs. So you may wonder, why did we even decide to start a podcast? Well, we found that we spend a lot of time together talking about dermatology. Why not include more people in the discussion?
So while you're on your walk to work, your morning commute, or wherever you may listen to a podcast, you can tune in as two board-certified dermatologists discuss some of the most important issues related to your skin.
This podcast is intended to serve as an educational resource about skin issues, a tool to empower people to take a more active role in their skin health, including skin cancer prevention, and more importantly, an outlet to discuss some of the current hot topics related to your skin.
We will skim, or shall we say, skin the surface of these issues, and we will not be providing any personal medical advice. So we would recommend that you consult with your board-certified dermatologist for any specific dermatologic concerns.
So, what does a dermatologist treat? Well, the skin, of course. Fun fact, the skin is actually the largest organ in your body. But it's not just the skin that we treat. Many people don't realize that we also treat conditions affecting the hair, nails, and mouth.
Yeah, that's so true. So many of my patients will come into the office for a skin-related issue, and then at some point they'll mention something going on with their toenail or in their hair, and then they'll often say, never mind, I'll talk with my other doctor about that. And it always surprises them when I tell them, well, no, actually, we can help address all those issues.
And it's not just medical dermatology that we're trained in. We're also trained in performing cosmetic procedures and surgical procedures. We're so fortunate to have the ability to see such a vast and diverse patient population, from pediatrics to geriatrics.
Yeah, I think that's really the aspect of this field that I love the most, is that we have a unique opportunity to see a patient throughout their whole lifetime. So from when they're young to when they're old, which is super rewarding. So Rina, can you tell us a little bit more about what it takes to be a dermatologist in terms of the training?
Yeah, of course. After college and 4 years of medical school, every doctor is required to complete a residency. This is the training you do in your specific field of medicine. For dermatologists, you're required to complete 4 years of residency. Some people even extend this training for one additional year and complete a fellowship, which is a more focused training in a subset of dermatology, such as pediatrics, Mohs surgery, dermatopathology, or even cosmetics.
So adding this all up and assuming you went to a 4-year undergraduate program, it's about 12, 13 years from college to the end of your training?
Exactly. That's why many of us have many gray hairs by the end of our training. That's also not including a dermatology board exam, which is a test at the finish line of all this training to prove that you are in fact competent to successfully practice dermatology in your community. So now you know what goes into the training and why it is so important to seek care from a board-certified dermatologist.
Thanks so much, Rina. So that's all we have for today. Tune in next week as we skin the surface and discuss one of the most common reasons why people will visit their dermatologist, the skin cancer screening exam.